happy to have you now, Dr. Fakorede. Did I say it right?
Yes, sir. Fakorede. Yes, sir.
Uh, Now, you've been very, very outspoken about the health disparities. What's one issue affecting our community that doesn't get enough attention?
Yeah, so every 30 seconds in this country and in this world, someone will lose their legs and their limb due to diabetes that leads to an amputation. And 90% of those cases are preventable, and no one knows the solutions to get to that preventable state.
Oh, wow. So, well, for those that don't know, what is PAD or peripheral artery disease?
Yeah, peripheral artery disease is basically clogged up pipes in your arteries in your legs that if they go on for a long time due to probably sugar or high pressure or which is hypertension and high cholesterol, it leads to basically early circulation issues where you have numbness, tingling, and burning, and can lead to a non-healing ulcer, a wound, gangrene, and they start chopping off the toes, chopping off the feet, and that's what basically peripheral arterial disease is. What people call it the sugar foot.
So is there any association with PAD and smoking?
Yes, ma'am. So PAD actually has multiple risk factors, meaning multiple things that can lead to poor circulation. Everyone knows about sugar foot, but if you've been chewing tobacco since you were 8 years old, if you've been smoking tobacco, if you chew or utilize any tobacco products, that increases your rates of poor circulation by 3 to 4 times.
Really?
It increases your amputation risk by 4 to 8 times. That's preventable as well.
Wait, what about
surprised to
vaping?
hear that.
What about vaping? Because everybody vapes now. Is vaping?
Yeah,
the
so
same?
vaping, you're absolutely right. Vaping too is part of that product as well. So we talk, if you smoke, you dip, you chew, you vape, that too is part of what we call the nicotine tree that can lead to a little bit of poor circulation and can lead to peripheral arterial disease.
Oh, my God.
Yes.
So when should somebody look into being screened for this?
So that's the problem, Ricky. Most people are not screened. And that's what we're trying to fight for, and that's why we need to raise awareness, because this problem is more prevalent in the black community. If you're black, your chances of getting PAD is twice as high than your white counterpart. If you lose your limb, you're 3 to 4 times higher than your white counterpart. So why do we have an amputation epidemic in the South? It's because people have leg pain when they're walking, when they're going to Walmart, their leg gives out on them, locks up on them, and they've had all these risk factors we've talked about. But also when they develop this slow wound that doesn't heal, or they've had, pain, numbness and tingling for a long time, we call neuropathy, and they have fatigue. Doctors don't take off the socks when they go into clinics and check their pulses or give them a vascular screening. Yes, actually, 90% of people who lose their legs here in the South, predominantly black or rural patients, have never had a vascular screening a year before their amputation. That's
Wow.
a big problem.
So should you go in and ask your doctor specifically for that? And does insurance pay for it? Because that may be a big reason why people aren't doing it.
Exactly. Well, we here it's twofold. You're absolutely right. You don't know what you don't know, right? And you can't be what you can't see. I always tell my patients that. One, how do I know that I have poor circulation? It's I use the analogy of cancer. This disease is deadlier than cancer. The only 2 cancers that are more deadlier than peripheral arterial disease are advanced lung cancer and pancreatic cancer. The death rate here, the 5-year death rate is higher. So if we screen for cancer because people don't feel cancer, right? You know your risk factors, you identify your risk factors, and you screen for it. And that's what needs to happen if you have high blood pressure, high cholesterol, nicotine use, if you're over the age of 50, and if you've had diabetes for over 10 years, yeah, you should have your doctor, your primary care specialist screen you for peripheral arterial disease.
So we know that the South is like diabetes headquarters. And is that just because of the way we eat? That's one question, but I got a double here. Why are teens getting diabetes?
Yeah, so the South is known as the amputation belt, the diabetes belt, the obesity belt, the heart failure belt, the stroke belt, because if you look at the enslaved population in this country, that belt also overlaps. We've had the poorest access to doctors, we have the least number of vascular specialists, and you have the least number of metrics that will improve what we call their social determinants: education, housing, transportation, access to physicians. So we're seeing now that diabetes is rampant in our youth. It's because of their poor social determinants of health. It's not a genetic problem. Everyone says, I'm fine. I have a genetic problem. Well, this happened. No, it's not a genetic problem. It's a lifestyle. It's access to what I'm seeing in the streets. It's drinking that sweet tea all the time. Is what are we giving in our vendors at schools? What are they drinking through those vending machines? And also, what are they drinking at home and eating at home and eating on the streets? Those are things that can lead to poor access. So if you live in a food desert, you will have access to poor choices.
So, doctor, as a cardiologist, so what are some of the lifestyle changes that people can start with today?
Yeah, so as a cardiologist, I tell people you got to move. You know, movement improves your circulation. But one, exercise at least 30 to 40 minutes a day if you can, or intentional walking. Not just say I walked at Walmart for 20 minutes. That's not exercise. You got to be intentional, one. Two is if you have any of those bad habits, if you chew, dip, or smoke, you got to quit because that improves your lifespan by 8 years. If you can do
Wow.
it. If you decrease your blood pressure by 5 to 10 points, that improves your life expectancy by 5 to 8 years. If you lose at least 3 to 5% of your body weight, that improves your lifespan. So that's why awareness and prevention to me are the most important things. Prevention is better than cure, right? So if you can prevent those things from progressing where people are saying, hey, I got to chop off your foot, or and not knowing that once they chop off your foot, 80% of those people will die within 5 years.
I was just about to say
Yes,
that.
sir.
I seen it with my own eyes every time somebody go through amputation.
Yeah.
I seen the amputation, like the day after the amputation, the pain that young man went through, and I promise you, in about 3 years, he had passed away.
So
I seen it.
that's very common. And so if I tell you that 90% of amputations due to peripheral arterial disease are preventable, that means 160,000 amputations every year that happen, predominantly in black and brown communities, can be prevented if they knew what we just talked about today. That's why kudos to y'all for having us on today.
Oh my God, man! How can people regain trust in the healthcare system? Because
We need another show
people
for
are.
that.
Yeah. And you know what? Let's have a
But
conversation about that when you come
I can
back.
answer that. I can answer that quickly. One, you need a doctor that basically can walk into a room, look you in the eye, put their hands on you and touch you and say, hey, listen, we're going to work on this together and figure out what's going on. Two, they need to sit right next to you and look you in the eye and say, you know what, I'm going to treat you like my brother and my sister, my father, my mother, my cousin. We've lost that trust in healthcare. We walk in with our white coats and we stand at the door and talk to patients, or we have the stethoscope and we think, wait, I'm at a higher level than you are. So that is meeting those patients where they are. And then two, I think you need to go outside of the clinic setting or hospital setting. You need to go to the community centers. You need to go to their churches or worship centers. You got to go to their sorors or their fraternities. You got to go to, their civic organizations. And, I've seen y'all do this. I mean, Dr. Kalia coming here every Wednesday. That is a true physician meeting his patients where they are.
Mm-hmm. Okay, so what's health myth, doctor, that you hear all the time and it makes you cringe a little?
It runs in the family, so there's nothing I can do. Or, my mama got an amputation, so it's okay if I got one. Genetics is kind of like loading the gun, and then lifestyle and, access are kind of like pulling the trigger. And that's something we can't do. So I think it's very important for you to not be a generational scar. And what I mean by generational scar is that just because it happened to a family member doesn't mean it has to happen to me. So that curse has to stop somewhere. And you have to inform to get transformed. And so listen to the things that not only are we saying here today, but you got to practice them so that you don't become that generational statistic that you see all over the map saying, hey, you know what, I live in Atlanta, so my chances of getting amputation is 50% higher than someone who lives in Colorado. That's we can't say because of family history anymore. We got to do better.
I really want to get you back on to have a conversation about that one particular question that we asked, as you said, that's a whole different conversation. We really have to have you back on to have that conversation because that's so important. Go ahead, Cheryl. You about to ask something?
Absolutely. But before I ask any question, I got to shout out the two doctors on here and my own doctor, Dr. Zuri Morrell, who's a Morehouse man, and he helped me lose over 100 pounds, no longer pre-diabetic and no diabetes. So what are some of the signs in adults and even teens that might be diabetes or that they're pre-diabetic?
Yeah, and congratulations to you and your doctor, and kudos to you also for helping to raise the awareness. I heard a segment on you in Jackson about a year ago with my boy, and so you've been out there speaking and preaching about this, Ms. Cheryl. One, if you've had microvascular issues, what does that mean? I'm losing my vision or something's wrong with my eye. Two, I'm having this numbness and tingling on my feet, or I just feel like there's pins and needles in my feet, on my hands as well. So we call it the stock and glove distribution. 3, you go see your primary care doctor and they say, well, you got a little bit of, something in your urine when they check your urine sample, glucose or proteins. Those are what we call microvascular symptoms. But also, if you have a family history where a family member ended up on dialysis, or you have a family history where someone got amputated, or you have a family history where someone had a heart attack, plaque buildup and clogging up pipes doesn't end at the level of your belly button. So it's not just that stroke or heart attack. You can also lose your limbs. It goes all the way down to your feet. So those are the things that have to be screened by your primary care doctor, by your pediatrician. And if they don't do so, you ask. And that's why advocacy is very important in that room. You ask the question, why are we not doing this? And if you don't get the answer, you seek a second opinion. Because Southern hospitality is out of the door when it comes to your health.
So, doctor, what's one daily habit that you personally never skip?
Well, my mom is listening, so other than prayer is is making sure that I work out and I exercise, either by walking or running or lifting weights. That's something I've done now for about 36 years, and it's something that's helped me mentally and physically. So that's why I tell my patients is to do that. Your sanity is important. So whatever makes you sane and healthy, so you can take care of others, that's important. And 2 is to make sure that you can minimize and reduce your risks of all the things that we talked about in terms of the risk factors that leads to peripheral arterial disease.
Okay, best piece of health advice you've ever received?
Prevention is always easier, and it's kinder than treatment. So prevention is better than cure. We know that. I mean, us talking about this right now, if we can save one limb, I told you every 30 seconds. So how many limbs are going to be lost by the end of this segment? So if we can prevent just one limb loss today, we've all won. So that's the one piece of advice.
Man, that's good. That's good stuff right there. Hey, let everybody know about your great event this coming weekend at Morehouse College and how can people attend?
Yeah, so the Nobel Prize Foundation reached out to me about in 2022 because of the work we've done in Mississippi, and I'm in the heart of the Mississippi Delta in decreasing amputation rates by 88% over a 4.5-year period. So they wanted to say, hey, listen, we've discovered insulin for years, and we've had Nobel Prize winners, but how come we have not decreased amputation rates? And so they did a documentary on how we've gone about reducing these amputations, and we were blessed to partner with the Bronze Lance Film Festival and the Morehouse School of Medicine and other partners this weekend. February 6th at the Morehouse School of Medicine, we'll be hosting a powerful event called Bloodlines Mississippi, Stories of Hope. It's free. It's solutions-driven event focusing on heart health, peripheral arterial disease, and we're going to have a great panel. We'll have a reception starting at 5:45. The film screening and panel discussions with clinicians, advocates, and community leaders. All of y'all should come, please. You can find more details on Eventbrite. You can put in Bloodlines Mississippi, and the title is Stories of Hope, and hopefully there are a lot of hope dealers and truth tellers in the room who can help us bridge the gap and disparities in this issue.
Man, we appreciate you. Y'all give it up, and thank you so much for joining us, and always thanks to you, Dr. Collier. Y'all give it up for the one and only Dr. M.J. Collier and Dr. Foluso Fakorede.
You got it, Ricky.